let's focus on diagnostic means and surgical management. So January, Dr. Lopez, I understand that one of the most important things that you do is look for the early detection of breast cancer.
We've come a long way in terms of how to manage and diagnose patients. Even a decade ago, there were a lot of surgical biopsies that were done actually if there's an abnormality, if the patient has a lump, or if we see something on the imaging. Not everyone would have a needle biopsy. They would go into the operating room and then be diagnosed in that manner.
And have an incision
and actually,
and a recovery.
Yes. And actually, of all the biopsies that we do, between 60 to 75% of the biopsies aren't even cancer at all, they're benign. So, in the end, they're very reassuring, but think of all the women that have undergone these unnecessary surgical excisional biopsies for things that don't even end up being cancer.
Yes.
So really, 99% of the biopsies that we do primarily for abnormalities are needle biopsies or core biopsies that we do. And we have a team of expert radiologists who are all specially trained and dedicated at breast care and breast imaging, breast biopsies and intervention. Yes. And that's extremely difficult to do, put together a team like that. Mm-hmm. There's actually a huge national shortage in radiologists, and especially breast imagers. Every day I get about 65 emails saying, we have a job here and there. And we have an amazing team of really close-knit specialists who are able to perform these biopsies. We really try and do
those under local anesthesia.
Under local anesthesia.
A pinhole incision.
Just a few seconds of just stinging with the anesthetic. Mm-hmm. Most patients, and I tell them this when I meet them, and tell them they need a biopsy, are very scared by the word biopsy, right, because it's just a scary word. But the procedure itself is really does not have to be painful, does not have to be scary. So we really try and do the best that we can to make that, process as easy as possible. And then you juxtapose that to going through a whole surgery to get the same result, which is kind of crazy when you think about it.
So I know that you've been really excited about a fast MRI program and that we're right on the cusp of offering something along those lines at Hoag. Can you briefly describe that?
Yes, and I am very excited about fast MRI. It's something that, as far as I know, is not present in Orange County, but breast MRI has been around for a long time. It's been around for over a decade. And it's just a different type of tool that we use for breast imaging. So the main tools that we use, we have three. We have mammography, which everybody knows. There's breast ultrasound, which uses sound waves to create images of the breast. And there's something called breast MRI, which uses a special machine that uses magnets to create images of the breast. And actually what that looks at is kind of blood flow pattern. We administer some intravenous contrast and we look at the way blood flows through the breast, and that's how we identify signs of breast cancer. And all three are really important. Our partner, Dr. Silverstein, talks about them as though they're a spoon, a knife, and a fork, right? They're different utensils, they work in different ways. One's not necessarily better than the other. But we know that with mammography, which is our gold standard for screening for breast cancer, it's really good, and we'll find most breast cancers, but not all breast cancers. And there are certain types of breast cancers, because breast cancer can look many different ways, that can be really difficult or sometimes impossible to see on a mammogram until it gets quite large in size. So MRI is the best way, is the most sensitive way to detect those types of breast cancers.
Okay.
But MRI is also a very expensive test and a very limited resource, probably the most limited in terms of the resources we have for imaging.
And it takes time.
It takes time. Yeah. Each one of those breast MRIs takes about 30 minutes. And it's very expensive because the machines are very expensive. Mm-hmm. So the resource is limited, but the power and the value of that test is so high. So, people who do what I do, breast imagers, have been thinking about this, and there's really a movement to try and figure out how we can open up or make breast MRI more available to women. Because now,
increasing access.
It's really kind of isolated. The access is mostly isolated to people who are either really high risk for breast cancer, like they have a 1 in 4, 1 in 5 chance of breast cancer, or other reasons, like they've been diagnosed with breast cancer and a handful of things. But we as women, right, even if we have just average risk, are still 1 in 8. We have a 1 in 8 chance of developing breast cancer. In Orange County, it's 1 in 7. I don't know why it's more common in Orange County, but So what do we do for women like us, especially who have maybe dense breast tissue, where mammograms can be more limited for finding those kinds of breast cancers? So fast MRI does not require a new, different type of machine. It's a different way of doing breast MRI, which uses a very short, abbreviated protocol. So instead of the 30 minutes, it takes between 3 and 9 or 10 minutes, depending on how we do the study.
So if you don't like being in a closed space,
yes,
that might be good for you as
so,
well.
and the benefit is almost as high as doing the full protocol MRI.
At a fraction of the cost.
At a fraction of the cost. So it is something that is currently in development, and like most things that we do with our program, takes a lot of resources and focus to do. But it is something that I do want to bring to Hoag.
Yes.
I want us to do. I'm very, very invested in fast MRI because early detection is so important in terms of the outcomes of women and saving lives. And I think that addresses the certain population of women where mammograms aren't doing enough for them.
So you're focused on early detection that gives all the different options that allows the minimally invasive approach and being able to live a longer, fuller life. Well, great. Thank you very much, all of you, for being here and sharing your passion and sharing your programs and for what you do every day to make the world a better place for women in Orange County.
Thank you for having us.